Hey guys, Jaden here, the exercise physiologist at Health Hub Springfield in Springfield Lakes, and today we're going to be discussing exercise for all levels, beginner, intermediate and advanced. Now, exercising regularly is one of the best things you can do for your health, but it can be hard to know where to start. There's a lot of information out there and it can be overloading. When equipped with the right knowledge, exercise can be a regular part of your daily routine. So what are the benefits of exercise? Exercising regularly will have immediate and lead to long-term health benefits. And these health benefits include improved brain and heart health, reduced risk of disease and other health complications, strengthened muscles, bones and joints, improved mental health and improved metabolism and weight management. There's a whole lot of other health benefits as well. How much exercise? Well, the Australian Physical Activity Guidelines recommend that you are active on most, preferably all, days of the week, working towards 150 to 300 minutes of moderate intensity activity a week, or 75 to 150 minutes of vigorous intensity activity a week, plus 2 days of resistance training a week. While exercising, if your breathing rate and heart rate have gone up and you can still hold a conversation with someone next to you, that is most likely a moderate intensity. Now, examples of moderate intensity aerobic exercise include walking briskly, actively playing with children, cycling around the block, and walking laps in the pool. While exercising, if you're breathing heavily and your heart rate has gone up considerably and you're finding it hard to hold a conversation, that is most likely vigorous intensity. Now, examples of vigorous intensity aerobic exercise include running, swimming laps, jump rope, rowing, and most competitive sports. Sets and reps are very common in exercise programs as they are the basic measure apart from time used to calculate how much exercise you have done. A rep or repetition is the movement and a set is a group of reps. For example, 3 sets times 10 reps of squats. This means you will do 10 squats, have a break and repeat 3 times. Now, there are recommended reps, sets and rest depending on your goal. If your goal is strength, it's recommended you do 6 reps or less, 2 to 6 sets and have 2 to 5 minutes rest. If your goal is hypertrophy, it's recommended you do 6 to 12 reps, 2 to 6 sets and 30 to 90 seconds rest. Now, if your goal is endurance, it's recommended you bump those reps up and do 12 or more reps, 2 to 3 sets and have a short rest of 30 seconds or less. Lastly, if your goal is power, it's recommended you do 1 to 5 reps, 3 to 5 sets and 2 to 5 minutes rest. For most people, the recommendation for strength training is anywhere from 2 to 4 sets of 8 to 12 reps for most exercise programs. They will aim right for the middle, 3 sets, 10 reps. Now, there are different types of exercise. Aerobic exercise, also known as cardiovascular exercise or cardio, involves large muscle groups working together for an extended period of time. Aerobic exercise targets the heart and the lungs. And examples of aerobic exercise include walking, jogging, cycling and swimming. Now, resistance exercise, also known as strength exercise, involves your muscles working against some form of resistance. Now, this can be as simple as moving from sitting to standing, squatting, doing a push-up or a bicep curl. Resistance exercise is the main type of exercise that helps build muscle and increase muscle mass. Now, some examples of resistance are your own body weight, machine weights, dumbbells, resistance bands, or even bottles of water. Now, flexibility, also known as stretching or mobility exercise, helps with muscle recovery, maintaining range of motion and injury prevention. And some examples of flexibility exercise include static stretching, dynamic stretching and yoga. Balance, also known as stability exercise, involves strengthening muscles to help with improving body coordination and proprioception. Now, this is important with age as balance exercise will help prevent falls. Now, some examples of balance exercises are heel-toe walking, tai chi, or single leg stance activities. Exercise physiologists, also known as EPs, are university qualified allied health professionals that specialise in designing and delivering safe and effective exercise interventions. Now, EP's domains include cardiovascular, metabolic, neurological, musculoskeletal, different cancers, kidney/renal, respiratory, and mental health. EP can design an individualised exercise program to assist with whatever goal you have in mind. During the initial assessment, the patient's goals will be discussed and some basic initial measurements will be taken. The initial measurements will include basic anthropometric measures such as weight, height, and waist circumference, and then some basic physical assessments too. After the initial assessment is finished, an exercise program will be tailored to the patient's goals and needs. It doesn't matter what level the patient is at, beginner, intermediate, or advanced, and EP can help with all exercise goals. A monthly follow-up is recommended with the EP to discuss the patient's progress and if there have been any barriers to overcome. The initial measures will be taken again to monitor the patient's progress. Then, the exercise program will be adjusted depending on the patient's needs and improvements. There is not a one-size-fits-all approach when it comes to designing an exercise program. Everyone's going to have different needs and goals. Below are some examples of basic one-week exercise programs for people at different levels of exercise. They can be adjusted as you need. First of all, we've got some bodyweight full body exercise programs varying from beginner to intermediate to advanced. With these programs, you don't need any equipment at all. You could be doing them at home. It's just bodyweight exercise. Next are some gym programs that are split programs. A split program means that essentially one day you'll be training upper body, the next day you'll be training lower body. The program is split up into its own muscle groups on different days. Now these once again are varying from beginner to intermediate to advanced. These are just some examples of exercise programs for varying experience levels. No matter what level you are, there are plenty of exercises that you can do. Remember, everybody is different, so those will work for some and won't work for others. To wrap it up, exercise is something that can be done every day to benefit your health. There are many different types of exercises, so don't be scared to try something new. It's never too late to start exercising. If you need any further assistance on starting your exercise journey and designing a program that is unique to you, contact Health Hub Springfield and book in an appointment to come and see an exercise physiologist.